Hi, this is Mick Falkel, Chief Medical Officer at Onpharma. And today we have Dwight Simpson on the phone. Dr. Simpson's been using Onset since the very beginning. As a matter of fact, he's part of a group that we call the Founders Club. Dwight Simpson is a dentist who practices in Jackson, California with the Jackson Creek Dental Group. Dwight, how you doing?
I'm doing great, Mick. It's good to see you. It's been a while.
Great. Well, thanks so much for being on. You have a lot of experience with Onset, and we have a new paradigm as we're moving back into the new normal in the dental office, and we call that seat, treat, and complete. Now, I know you've been using Onset effectively in your practice. Could you tell us how you use Onset, or how you think using Onset could help you or help dentists maintain their patient volume?
Well, it's interesting. I was just talking to Greg the other day about this because I hadn't really noticed much of a difference. Um, I've been doing a seat, treat, and complete type protocol for the last 8 years since I started using Onset. I don't leave the room. So I know I've talked to a lot of dentists in the past that go do other exams, things like that during the time they're waiting for anesthesia. But with Onset, I don't have to wait for anesthesia. So I've always moved my exams to in between my patients. And so this has actually been nice because I save PPE. I go into the room, I don't have to take off my gloves, I give the anesthetic, and I'm able to start working after giving a nice slow injection, putting a rubber dam on, and start working right away. So I don't ever have to change out PPE. I'm able to complete the procedure, do my documentation, then move on. And as we're moving back into starting to see hygiene patients, it'll be seamless as well because now my hygiene exams are already built into in between patients rather than during the anesthesia time.
Oh, that's great. So I do exactly the same thing. And I had a practice management consultant come in right at the very beginning. Her name was Cindy Ishimoto. And, she watched me work and what I did, and she kind of showed me how to schedule around that. And that's basically scheduling in serial instead of parallel. So parallel would be jumping around from patient to patient. Serial is one patient at a time. And she actually helped me because, her thought was if you're uninterrupted, you have a much more efficient workflow while you're doing the procedure. And so not only are you saving the anesthetic wait time, but you're also more efficient in what you're doing by not being interrupted. So she showed me how to parlay that together. And I took a 4-day schedule, brought it down to 2.5 days, and had the same patient volume.
Yeah, exactly.
So I think it's intimidating for dentists to come back to work, know that they can't leave because they got to conserve the PPE, and they also have to reduce cross-contamination. And if you can do that with Onset and maintain or maybe even improve your patient volume, that would be a win for most practices.
Well, and think too, if you're having to wait to find out if your anesthesia worked, what if you're given an IA and you have to do it 2 or 3 times? You could be sitting in that room for 20, 30 minutes before you know. Where with the Onset, I'm able to tell right away after giving a slow IA injection, I know whether it's working and I know whether I can proceed or whether I need to re-inject. So that saves a ton of time, and I never have to change PPE with that. So it's a big plus. And then, of course, seeing all these emergencies, the buffering ability of this in the presence of infections, it helps me to be able to keep moving when I have somebody come in with an abscess tooth that needs to be taken out or something like that.
Well, that's great. So for those of you that don't know, the reason Onset helps with infected patient is that when we inject into infected tissue, that pH of the tissue can be as low as 5.0, and our anesthetic coming in at 3.5 just can't. The body can't buffer it. So we normally send people home on antibiotics and then have them come back another day when we've reduced the infection a little bit. With Onset coming in at a physiologic pH, we have a much better chance of getting those patients numb. So you really find that out in a period like we've had over the last 6 or 7 weeks when all we're treating really is emergencies.
Well, and back to leaving the room, you got to think there's a lot of fear out there around this pandemic. And when you leave a room, the patient doesn't know where you've been, where your hands have been, anything like that. But when you can come into the room, wash your hands, complete the procedure right there by their side the whole time, they know exactly where you've been.
Yeah, you know what? As we come back, we're going to be treating dentistry, but we're also going to be treating emotion as well. And that's an exact example of how we can treat emotion positively by staying with the patient. And they then know, either consciously or even subconsciously, that we're not breaking the chain of infection control. So great
Yeah.
point.
And right now, when you were saying about the time management on this, I'm thinking if I have to leave the room, especially if I don't have hygiene, what if I'm not doing hygiene like I've been doing for the last few weeks? Now, each time I'm waiting for anesthetic, if I were having to wait like I used to have to wait 10, 15 minutes for an IA injection, that's 10 to 15 minutes out of every procedure you do that on. And at the end of the day, that can easily be an hour if you don't have something else to be productive with during that time.
Great point. Well, it sounds like treat or seat, treat, and complete can be done efficiently if you have some extra tools. And so I really appreciate you being on the line and helping people understand with somebody who's been doing it like I have for 8 or 9 years now. So thank you so much. And
You bet.
good luck as we all come back.